Good afternoon, everyone. I'm Dr. Michelle Taylor, Director of the Shelby County Health Department, and I'm here to give the COVID briefing for the Joint COVID Task Force today, and I'm going to show a few slides. Total COVID-19 cases reported today, 145,070. New cases reported today, 102. That is down from 122 this time last week and 294 2 weeks ago. It is interesting to note that for several days this week, from Sunday, October 17th to Tuesday, October 19th, less than 100 new cases were reported each day. The 7-day average of cases per day is 114. The 7-day average has also continued a downward trend, down from 143 this time last week and 237 2 weeks ago. We continue to see a downward trend in active cases in every age range, including pediatric cases. Today, we report 326 active pediatric cases, down from 558 last week and 823 2 weeks ago. Pediatric cases now comprise 24% of all active cases, down from 28.9% this time last week and 29.9% 2 weeks ago. This is significant and encouraging news because protecting vulnerable children is one of our highest priorities. Next slide. The 7-day average test positivity rate is now 6.8%, which is up from 5.8% this time last week and on par with 6.9% rate we reported 2 weeks ago. The lowest positivity rate we have seen during the pandemic is 2.3% back on June 21st, 2021. Next slide. The effective reproductive number, or RT, of the virus is now 0.73, down from 0.75 last week. RT has continued a downward trend that began in September and coincided with the mask mandate in indoor public spaces. The hospitalization data also shows the same downward trend we have seen in active cases. Today, 202 COVID-19 positive persons are in regional hospitals. That is down from 317 this time last week and 370 2 weeks ago. Next slide. This is a new slide that shows a comparison of what Shelby County looks like to some of the other counties and localities that are located near Shelby County. As you can see, the blue line at the very bottom of the graph shows that our case rates have remained lower than all of our contiguous counties and localities to date. Next slide. And if you were wondering how we compare to some of the other urban counties in the state, this is just one example. Knox County is shown in the orange line, and Shelby County is shown with the blue line. And even though Shelby County has had lower vaccination rates than Knox County, we continue to stay lower in our case rate when compared to Knox County. And we can see that if you look at the month, August, when we began the mask requirements in our schools and in our indoor public spaces, you can see that our decrease was much faster and we have remained lower in spite of having lower vaccination rates in Shelby County. Next slide. And this is a slide that you're familiar with. All of our active cases by age group continue to decrease across all age groupings. Next slide. As you see, the active cases continue to be concentrated in zip codes that have the lowest rates of vaccination, with zip code 38127 reporting the highest active case rate. Next slide. And this is a similar slide, but shows where the concentration of active pediatric cases by zip code are. Next slide. And this is a new slide today as well. It illustrates what percentage of vaccinations given each day that are first, second, and third doses. You see, well, I'm sorry, this is actually a chart, and what you can see is that the percentage of initiated, completed, and then additional doses. Please note that the completed and the additional dose percentages do not overlap. Right now, with the boosters in place, We have about 3.8% of our population in Shelby County that have already received additional doses. Next slide. This is a slide showing what I just showed you on the chart, which shows that there is a spike in third doses in late September, early October, and to date, the majority of the vaccine doses that we are seeing being given in the county are third doses. But, as you know, we would like to see an continued increase in the rate of first doses in order to reach our vaccination goal. This is the last of my slides for today, but what I would say is that right now, regarding vaccinations, currently 53.2% of the eligible population has received at least one dose of vaccine. That is a slight increase from 52.9% reported last week, and currently 41.3% of the population is considered fully vaccinated, meaning that they have received 2 doses of Pfizer, 2 doses of Moderna, or 1 dose of Johnson & Johnson, and have completed their series of vaccinations. There have been significant developments as well on the vaccination front in regards to kids ages 5 to 11. Yesterday, the White House unveiled its plan to get COVID-19 vaccinations to children age 5 to 11 as soon as possible after those vaccinations are authorized, and we know that those meetings with the FDA and the CDC have already been scheduled, and we are scaling up with anticipation of an approval sometime in early November. With that, I'll take your questions.
Brad Broders, ABC 24.
Thanks, Dr. Taylor. Perfect segue to your last comment. First question: what for parents out there wondering any plans, details you can tell now about the game plan for how to get those 5 to 11s vaccinated when hopefully sometime next month they'll be eligible? And I have a follow-up.
Great question. So the good news is that Shelby County Health Department has been in constant communication with the Tennessee Department of Health. And we know that Tennessee is going to get an allotment just like every other state across the country. And we know that we will be able to pre-order those vaccinations very soon. And so what I can tell parents who are anxiously awaiting being able to get their kids 5 to 11 vaccinated is that Shelby County Health Department and the other providers in the community will be prepared to start giving those vaccinations almost as soon as they are approved. We're making preparations now.
And as a follow-up, Dr. Taylor, are we thinking it's going to be children going with their parents in the Pipkin building? Has there been thoughts about schools, district offices, pharmacies? Will there potentially be any different ways that 5 to 11-year-olds will get vaccinated?
That's a great question. We're making preparations. Of course, we can't say everything that we're going to be able to do because we have to wait and see what the protocols are going to be after the approvals. So I don't want to speak too soon, but what I will tell you is that everything is on the table, and so that when we do get the protocol, we'll be prepared to exercise whatever we're allowed to do in regards to vaccinating those 5 to 11-year-olds. As you can imagine, that's going to be a game changer, not only for the country, but especially for Shelby County. It will drive our vaccination rates up, and most importantly, it will protect even more people in our community.
Kelly Roberts, WMC.
Good afternoon. Talking about those vaccinations for the young ones as well. I know President Biden outlined some of the plan to push those vaccines out kind of right as they are approved. Some key points to his plan is, that these things be available and administered in areas that families and children are comfortable with, and also just the equity of the distribution. Are there certain circumstances or that may somewhat be unique to Memphis in the sense of children who have or have not or don't have a pediatrician? And are there thoughts as just this health body in Shelby County to make sure that there is equitable distribution, whether you are going to see your primary physician, or if you're seeking maybe a public pod or clinic to receive this vaccination for your child.
Great question. So actually, Shelby County has always been blessed to have lots of providers who can give vaccinations to children, even pre-COVID. And so that has contributed to our ability to make sure we stay equitable in health access when it comes to vaccinations. Now, with that said, we know that parents will want to exercise different options, and they'll want to know what options they have. And what I can tell you is that everybody in the community has been awaiting this development. And so by the time we get to early November, we will know who can give vaccinations, we will know what kind of volume they can handle, and we will be ready to not only give vaccinations ourselves at Shelby County Health Department, but we will also be ready to support those providers in the community who want to do it as well. And so I believe that parents are going to have a lot of options. We are already reaching out to different providers to make sure that those options are available. And so we will have more information as we get closer to an approval date with available resources for parents who choose to have their children vaccinated. We want to make it as accessible as possible. We believe in health equity in Shelby County, and we will be believing in that even as we prepare to vaccinate our youngest of the population.
Thank you so much. And my second question, I've been told that some people who are being alerted that they would probably have to go into a quarantine after a family member, they themselves were possibly exposed to COVID-19. They're getting an email about that from the health department, but I'm getting reports that that email is coming very late, like 10 days after they were first told of possible exposure, for example, their child at a school. I'm wondering, what the process is to sending out emails like that within the department. Is there a staffing issue, that some of these are being sent so late and kind of after the point that would make much of a difference?
Great question. So not a staffing issue, but what I will tell you is that since we are starting to come out of this latest surge, as you can imagine, it's really difficult to contact trace when you're having 800 plus cases a day. Now, with that said, the other thing you should remember is that sometimes there is a duplication because we want to make sure that we are contacting every single person who may have had an exposure. So we have our own contact system within the Shelby County Health Department, but sometimes even the Tennessee Department of Health will pick up some of that contact work and send an additional notification. And then the other thing to remember is that most families and most people who are considered to be exposed will receive a text message at least. And then if they do not respond to the survey that's attached to that text message, then the email will start and a call will be attempted. So there are several different ways people are contacted, and we just want to make sure that we're contacting people. Sometimes we may not be able to contact as quickly as we want, but I think in a lot of those cases, it's a duplication of effort, just making sure that we reach everyone who may have possibly been exposed.
Hannah Grabenstein, MLK 50.
Hi, I think you touched on this a little bit in the earlier responses, but I'm just wondering, is there anything that you or your team has learned from the adult vaccinations that you plan on applying to the children vaccination program?
Great question. So really, it's not even just the adult COVID vaccinations, but our team is very skilled in giving vaccinations, period. And what I mean by that is we know that there are some differences in doing a drive-up vaccination pod for adults versus doing a drive-up vaccination pod for kids. And so if I can talk as a pediatrician for a second, one thing that we have been doing some pre-planning around is if we do have some mass vaccination sites for kids, or if we decide that we're going to add additional vaccinations for kids at our existing sites, we know that more than likely we need to have a separate tent. We need to be able to have a separate lane and possibly take those kids out of the car and be able to hold them a little bit more effectively than we would have to do for an adult. So those are things that vaccinators know very well. We've already started to talk through those, do some tabletop exercises, and really think through how this would be different for kids. But it's from years of experience of just vaccinating different types of people, period.
Thank you. My second question is I guess I don't really understand. All of our numbers seem to be heading in the direction that we'd like, except for that positivity rate. And I'm just wondering, is that just a facet of less testing, maybe less accurate representation, or if the reproductive number is dropping, it doesn't seem like, I guess, could you just help me understand why that positivity rate got a little higher?
You always have the best questions. So it's really a statistics thing. So if I had put the slide up, you would see that we actually have slowed down in our rate of testing in Shelby County. So what that means is if you have less tests, but you still have a lot of positives or a certain number of positives, sometimes it looks like that percentage is higher, but it's just a percentage of the total number of tests that were done in that 7-day period. And so you're right to notice that there seems to be a swing, but that has a lot to do with, not to get too far in the weeds, with what the denominator is. So if the denominator is smaller, then sometimes the percentage may look bigger, even though you're testing less people. Does that make sense?
Makes perfect sense to me. That is what I assumed, but wanted to make sure was the case. Thank you.
Jane Roberts, Daily Memphian.
Hi, Dr. Taylor. Will the Shelby County Health Department be leading the charge to vaccinate the 5 to 11-year-olds? I'm just wondering where the overall sort of direction and management will come from, and then I have a follow-up.
Great question. So what I will tell you is that we have and you know this, we have a joint COVID task force, and that has been in place pretty much since the beginning of the pandemic. And so Shelby County Health Department is a partner in that, but we will be consulting with everyone on that task force to make sure that we get those 5 to 11-year-olds vaccinated.
And Dr. Taylor, can you tell me how many children we have in the county who are 5 to 11?
So right now we have about 92,000 5 to 11-year-olds in the county. And so that's one of the things we're looking at to try to determine what percentage we think will actually have parents who will bring them out to be vaccinated. But that number is around 92,000. And if you need the exact number, I'll get it to you after this.
Catherine Burgess, Commercial Appeal.
Hi, Dr. Taylor. I'm wondering if we've received any indication of when Memphis businesses can expect OSHA to start requiring vaccinations at businesses with more than 100 employees.
Great question. We have not gotten that notification yet, but we have started to socialize that that's coming, and we've had been invited to some meetings to kind of discuss what we know so far. We are waiting for that date. I imagine that OSHA has to really come up with what the language will be and make sure that everything is in order so businesses will know exactly how to follow the rules. But we have been consulting with businesses and helping them to understand how to put in those kind of programs that would say, oh, okay, if you have more than 100 employees, first you need to determine how many of your employees may not be vaccinated, and then decide how you're going to accomplish following the rules, which means how you're going to accomplish either convincing those employees to go in and get vaccinated or setting up some kind of regular testing program for those employees who choose not to vaccinate. Now, of course, with private businesses, they have a lot of leeway in what they can mandate as a condition of employment, but we have told all businesses to make sure that they consult with their attorneys first to make sure that they are following all applicable labor laws.
Thank you.
Go back to Brad Broders with ABC 24.
Thanks, Dr. Taylor. I know next week the new directive is going to be coming out, but for those in the public wondering about any potential easing up on mask restrictions, is there any preview or any information you can divulge to the public about what to expect in the next directive?
So what I would say is that the most that I can say right now is to expect that we will continue to use a data-driven approach. And what we know right now is that in our adult population, we still have about 13% of that adult 18 and up population that's vulnerable to being infected with COVID-19, meaning that either they have not had a natural infection with some natural immunity, or they have not been vaccinated, or a combination of the two. Now, what we also know is that we still have, even though we're anxiously awaiting approval, we still have a significant portion of our population, those 92,000 5 to 11-year-olds, who are not eligible to be vaccinated. And so if you add them to the mix of that 13% still vulnerable, we get to about 25-26%. That's still 1 in 4 of our population, total population, who could possibly be infected with COVID. So with all of that in mind, we're really urging people to be patient with us. We want to protect everyone in the county. We know that people are getting tired of this 19-month marathon, but if we can keep our mitigation efforts in place for just a little longer, especially with the holidays approaching and people planning to gather, then I believe that if we can get those 5 to 11-year-olds approved for vaccinations and vaccinated, then we can start to talk a little bit more about easing restrictions. But for right now, 1 in 4 people still being at risk for infection is pretty high. And so we have to take all of that into account. But what I can tell you is that we continue to use a data-driven approach to decide what needs to be in each and every directive that has gone out.
Hannah Grabenstein, MLK 50.
I guess as a follow-up for that, I'm wondering, what if we never hit the threshold that the health department thinks is the threshold for I mean, I know that there will be ultimately infection, like as endemicity approaches is what I'm trying to say. Like, how do we cope with this as something that is like probably going to be around for a long time? You know, are we looking at using those kinds of mandates even if we don't approach like full vaccination or full infection?
No, I think you're thinking of it a little bit wrong, but I'll try to clear it up. So what I would say is that the data is leading us toward COVID eventually being a lot like the flu, where it would be seasonal, we would know when it's coming, and more than likely there will be a vaccine available for people to protect themselves. So right now, at the 19-month mark, we know that in Shelby County, we still don't have enough people vaccinated to reach that magical herd immunity number that we originally started out with. But we also know that the vaccines are widely available and safe for everyone 12 years of age and up. And so if we could get our vaccination rates up even in that group, we would be looking a lot better, and we would be really considering easing those mitigation efforts even sooner. But we're not there yet. And so I don't think that we're going to get into this thing where we're in masks forever. I think that there are some people who will wear their masks forever. I really do, because they see the benefit in it and they know that it slows down transmission. But I do think that we will eventually get to a point where you will show up, you will get your flu vaccine, you will get your COVID vaccine for the season, and you'll be protected.
Kelly Roberts, WMC.
Thank you for taking one more question from me. Just to follow up, and I think it might be kind of maybe a quick answer, but can we assume masks in the new year, even into 2022 at this point?
like I said, we will always use a data-driven approach in Shelby County. And what that means is that we are already looking, because we know this current directive is about to expire, and we will use local trends, local data, what we know is going on in the community to decide where we need to go from here.
Those are all of our questions today. Are there any closing messages?
Closing message is simple. There are several mass vaccination sites, one in Whitehaven, one in Germantown, there's still one at the Pipkin building. And anybody 12 and up can go and get their first, second, third, or booster vaccinations. And really, you need to be taking advantage of that. And then remember, we are doing so well. The numbers are coming down. We are highly encouraged by that, but we are still asking that you wear masks whenever you know you cannot safely socially distance. And we are requiring masks in all our K through 12 schools, daycares, and pre-Ks, and in indoor public spaces. Thank you so much for everything that you've done so far to get us to this point, and let's continue to do this together.
Thanks, everyone. We'll see you back here next week. Have a great weekend.